to let you know. Okay.
The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. This is Aaliyah Martin from Health Resources in Action with the Community Health Training Institute. Welcome to today's webinar. Today we are focusing on policy systems and environmental changes. And today we're going to be talking about some of the differences between that and programs. The way that we will do this is to highlight specific examples from across the state of Massachusetts, and not only examples, but tools that you will be able to use to hopefully use in your own communities. We are delighted today to have a number of different presenters joining with us. We have Nicole Borden from Springfield, Mass in Motion, Barry Keppard from the Metropolitan Area Planning Council, myself, Aaliyah Martin, as well as Kathleen McCabe from Health Resources in Action, and Karen Pullman from Baystate Health. And each of us will be sharing a bit of a different perspective, but all, of course, the same thing in terms of policy systems and environmental changes and how you might be able to leverage that in your communities. So we thank you, everyone, for joining us. Some logistics for today's webinar. You are able to ask questions that we will review and take at the end of all the speakers. You can use the question box in your control panel, which should be on the right-hand side of your screen. You can type a question, and we'll be sure to have it addressed at the end of the webinar. Also, at the end of the webinar, once we close out everything, you will get a quick survey that really is just a very quick evaluation to let us know how we did so that we can improve for future webinars. Also, I want to remind everyone that after today's webinar, in 2 weeks, you will receive an email with a link to today's recording, as well as a link with the slides so that you can make reference and use of it in the future. So again, this is just a screenshot of the toolbox and the toolbar that you can use to be able to ask questions. Today's speakers, as I shared with you before, we have a number of different speakers, and I just wanted to share with everyone sort of our pictures and how we look. I think sometimes with webinars, it's just, voices sort of talking on for a while, and there's not as much connection. So this is who we are, and so hopefully we'll be able to have some good questions from you all as well on these topics. So just to get us started, it helps us to sort of know where you all are in terms of your knowledge and your familiarity with policy and systems change. So I'm going to launch a poll question. And so if folks want to participate to be able to answer this first question, which is how familiar are you with policy systems and environmental changes? So the poll question is now open, and so I just want to give folks just a couple of seconds there to be able to answer that question. There's no right or wrong. It just helps us know kind of where you are. So I think mostly everyone has participated now. I'm going to close this poll and share with everyone the results. So with the results, you can see that 2/3 of folks on the call or on this webinar are somewhat familiar with policy and systems and environmental changes. And some of us on this webinar are not familiar, so I'm glad that you all are here so that we can all learn and share together to increase your knowledge and familiarity. So thank you, everyone, for participating. So I wanted to just sort of start off and talk about what exactly are policy systems and environmental changes. When we think about a policy change, we're really thinking about laws, ordinances, regulations. I mean, these can be both formal and informal. And so when you think about policy change, it is really just that, changing a policy. An example of this might be organizational policies around being able to provide folks time off to actually exercise during the day, and providing that provision as a benefit to folks who work there. So that would be an example of policy change. Systems change, this can impact tons of different elements within an organization or within a system. And these types of changes can include systems that could be school systems or transportation systems or any of the other type of systems in which we live and operate. And an example of this could be within a school system where school lunch is provided, but perhaps there are salad bars that are instituted. And it may not necessarily be a hard and fast policy change which says, at lunchtime we will always have salad and it will include these specific elements. But it is a systems change that now perhaps there is physical space for a salad bar to be offered. So that would be an example of a systems change. And even as I'm going through these definitions, you will start to hear where there is overlap, which is why they're often lumped together as policy systems and environmental changes. Environmental change, of course, is changing our physical environment, or economic or social environment. Again, this picture is a great example of what it means to change the environment or the built environment specifically in which we all live and operate. So this could be incorporating sidewalks, walking paths, bike lanes, to really change the design of a community. There is a great importance of policy and systems change. This is from the CDC. This is the Health Impact Pyramid. And what you can see, these are different ways in which you might be able to impact health. At the very top of the triangle, there are counseling and education, which is often done in one-on-one situations. There can be clinical interventions. There can be changes to the context, so having a bike lane or having corner stores that are able to offer more fruits and vegetables could be another example of changing that context. And then at the very bottom of the pyramid, we have the socioeconomic factors. And the reason why, besides the shape of the pyramid, but each of those are placed strategically within the pyramid, really showing how they're able to impact health. So if you're able to somehow impact changing the context or changing social economic factors, that's actually where you're going to have the biggest bang for your buck in terms of being able to influence and improve health. While counseling and education is extremely important, it's often done one-on-one. And going one-on-one can take a long time. Not everyone comes to a doctor's appointment or comes to a specific counseling session. But if folks are changing the context, we all live in an environment together. So if that context is changed, you're able to affect and impact more people. There are some differences to policy changes versus programs. As I was explaining before with the counseling example, programs can often be at an individual level. They can often occur only one time. Oftentimes they're difficult to sustain because of the amount of money that's needed, because each time you're going to need a large sum of money to keep a program going. And it's difficult to sustain because of that. Policy and systems change, this is something that's ongoing. It can lay a foundation on which programs can be built, and you're really, again, affecting that bottom part of the pyramid so that it is sustainable, it can be long-term, and again, you're affecting multiple people at the same time. So this is just a quick example from schools. I had given one earlier with the salad bar. Here again, if you're looking more at a program in a school, it could be, for example, the second one there, participating in a walk to school day, which is great for schools to be able to participate in that, but walk to school day is not every single day. So it could just be a one-off event, or perhaps you're participating in your statewide walk to school day as well as the international walk to school day. However, if you look into the other column and you're establishing an actual safe routes to school program, I should put that in quotes, you're really looking to change the system in which students are getting to and from school so that folks can be able to walk and bike to school on a regular basis. So there again, you're having a larger impact on the health of the individuals in the school. Policy and systems change is more comprehensive. It can be supported by a number of different things in terms of assessing what is the need for the policy change. It also involves engaging the community. Sometimes with programs, it's a directive. Someone gives funding and says this community is going to have X program. Whereas with the policy change, you really get an opportunity to engage the community, to have them be involved in terms of building their skills and their education, so that they're actually taking ownership of the policy change that's there, which is great for sustainability. You're also able to, as again I said earlier, have a policy change even be the foundation for some of the programs. So in the previous slide when I was talking about Safe Routes to School program, and I sort of said that should be in quotes, you can have an established program of Safe Routes to School built upon a policy, especially if you're looking at health policies within the school. If there's a health policy council that has put in place a specific policy that this will be something that will be established for the school. So again, policy and systems change is comprehensive and can include some programmatic efforts. Some of the catalysts that help bring policy change into being is, of course, if it's being built off of something else that has already taken place previously. It's a great opportunity to be able to look at data for your community and really come together as a community and say, what is this data saying to this, and what sort of policy and systems and environmental changes might lend itself to dealing with whatever this issue is. It's a great way for folks in the community to be able to advocate for some of those changes that they want. And then with funding, if you notice, there are more and more funding opportunities that are providing seed money for folks to really be able to start thinking or continuing to think about having these types of policy systems and environmental changes in their community. So one sort of quick example nationally that we can all relate to is just around seatbelts. If you sort of look at where we are today versus where we were 50 years ago. 50 years ago, we didn't really think about seatbelts. Cars weren't manufactured with seatbelts in them. And sort of as you go through time, some manufacturers, put these seatbelts in. Sometimes people used them, sometimes they didn't. And we knew that people's health were being detrimentally affected by this through car crashes, through head injuries, through being thrown from a car in some sort of accident. And so as we go through time, we see that these seatbelt laws change for the good and for the safety and for the health of the population, to the point where it actually changed engineering. So now you actually see cars, it's unheard of for a car to be created without having a seatbelt in the front seats as well as in the back seats. So it's interesting to think that policy and systems change can actually affect business, it can affect manufacturing, and it can affect it in a way that it becomes the norm. And that's really the power in a policy change, is that it can become the norm and therefore it can become sustainable. And now where we are today with seatbelt laws, in every state in the United States, we have to have seatbelts, whether we're driving or whether we're a passenger. And that's just a known throughout the country because of these systems changes that have taken place. So I just wanted to share that with you all, just to sort of ground us in what policy and systems changes are. And I just want to ask another poll question, just to, again, help us know where you all are and what some of the things are that you all are working on. So our poll question is, are you currently implementing policy, systems, or environmental changes in your community? And you can answer very quickly yes or no. And if you are implementing them, if you want, you can actually share either in the chat feature or in the question feature what some of those changes that you're actually implementing in your community. So we can see from the results that 72% of us on this webinar are actually implementing policy systems and environmental changes. It's a mouthful to say, but it's great to hear that folks are doing this work. Some of us are not doing this work, but hopefully after today's webinar you will be able to join in these efforts. So without further ado, I'm going to stop talking, and I'm actually going to pass this off to our wonderful presenters. We're going to now shift to Barry Keppard from the Metropolitan Area Planning Council. He is currently the manager of the Public Health Division there. Previously, he's worked as a senior regional planner with MAPC. He's led work for the implementation of the Metro Future Plan through a combination of public health, land use, environmental, and transportation planning projects. So I'm going to turn it over to you, Barry.
Thank you, Leah. And you'll find as I go through the presentation that in the beginning I'm going to echo a lot of what Aaliyah said, as well as also, I guess, potentially put my framing on and how I come at some of this as well, too. So starting with this slide, I want to picture yourself as that person in the orange headband. Probably a situation we all want to avoid to the most part, although I guess there's some cardiovascular benefit to being in that perspective. But for a moment, just think about being that person, and then I'm actually going to shift you back to those three individuals that person is running from. And I think we also want to consider this idea of zombies and whether or not how those people got that way, because clearly they didn't start out that way, and whatever they ended up was really an unhealthy situation. And so we think about how did that transportation really occur, because it's not really normal to become a zombie, and it's not really normal for something to kind of end up that way. And so it's probably not an unhealthy diet. It was probably not something about where they lived, but something happened in their life. So really, where and how did that start? And so just from conceptually, was it a recipe? Was it something about where that was being put together, either maybe some type of medicine or something that they were getting? So is it really in some type of book or cookbook that showed what this would be, and did somebody get something wrong? Did something happen potentially in how that was transported and that connection was being made between what caused it and where it was going, what that source was? And then maybe on those third set of pictures, was it how it was being delivered? Was there something that happened there that actually led to it? So obviously an unhealthy situation started, but it had its foundation and had its roots somewhere else. And so for me, I think that's the way that I kind of come at and think about conceptually, at least from a story framework, of how we get at policy systems and environmental change. So really, how can we get to the root and to those drivers behind what can be healthier outcomes, but also what can those drivers be that can reduce health inequities? And when I'm talking about health in this regard, I'm thinking about social, mental, physical health, issues related to the physical environment, natural environment, social environment that we're in. So for a moment, just to echo what Aaliyah mentioned, policy changes, again, I think is really those places where what we're looking at and what we're thinking about emanates from. So the foundation of what it is that we're looking at, maybe it's something that's regulatory, maybe it's something that's a resolution, maybe it's something that's just kind of an agreed-to statement, and everything kind of comes from that, and decisions that people are making are ultimately emanating from that. Or potentially thinking about the systems change. What are those internal workings that are being built upon the foundation, that are being used to give form and function to that foundation? And then lastly, what is it ultimately resorting to creating in the physical environment that we're in? So just take a moment, I think, in response to that question earlier, when you say that you're working on policy systems, environmental change, yes or no, just continue to think about that framing. What should these levels are you at right now? Maybe it's all of them in your particular area, but maybe not. So that's a description essentially for those of us who might be verbal learners, but I also tend to be kind of a visual person myself, and so sometimes it helps for me to kind of have some images with that. So I don't know if anybody remembers Schoolhouse Rock, but the I'm a Bill guide, to think about policy changes, kind of the inner workings of a fan. So what are those functions that all go together to really make a fan work? What are those individual pieces? What are those systems pieces? And then environmental change. What are those bricks that we're really using to create something real and that we all kind of experience in the real world. And so I'm going to use these kind of as three tags that as we go through the rest of my presentation, I'm trying to kind of tag and give you a sense of what level I think these changes are occurring along with policy systems and environmental change. Also, just to frame what I'm going to talk about, I'm going to be talking mainly about my experience coming as a planner, as someone who works with cities and towns, thinks about issues related to transportation, land use, as well as kind of physical development of the land too. So a lot of those examples I'll be walking through, and most of these that I'll be talking about are either kind of live work that's going on now that we're doing, or it's kind of ideas and areas that we're thinking about targeting when we think about policy systems and environmental change. So the first one I was going to start with was the idea of complete streets, and I'm sure many on the call are familiar with it, but just as a quick refresher, we're just thinking about how we design our roadways so that we're thinking about all users, so people who drive, people who may walk or bike, people who may take transit. We're also thinking about people of all abilities, so potentially people that have full abilities and can walk, but also people with disabilities. But we're also thinking about all ages too, knowing all the way from the youngest person who might be walking to school to the oldest person who might be in our neighborhood or in our city or town. And I think an important thing, at least for me when I think about complete streets, when you think about driving, so much of our system is built around driving, but it's also built around those people who are most fully able. Can you react quickly? Do you have good eyesight? Can you control the car? There's actually a lot of factors that go into that. So thinking about these other modes is just as important, whether or not you have that option or not to drive. So there's a variety of ways that you can go about achieving complete streets. And so the policy is one part of a larger framework of pieces that go into implementing complete streets. But the policy is an important part. For to me, as I mentioned earlier, it's a foundational aspect. Having that policy in place, whether it's an ordinance, a resolution, a bylaw, it creates that foundation which then drive a lot of the other changes in an area. And it's a way for decision making to occur that may not have form right now. And so it's a very important part for me. And I would just offer here too that Massachusetts just had a number of complete streets policies that were recognized as top complete streets policies in the country. And so if anybody's interested, I would definitely recommend looking that up because there's some really good examples there if you're thinking about it for your area, your city, or town. And so one of the ways we've been going about doing this is that once we have a policy passed, we've been trying to think and have a framework that we can work from to think about what are those system pieces. So if we think about the policy being the idea of the fan, and then we want to build the fan, what are the pieces that are all going to go into it? And so what you have in front of you now is a framework that we've been using to kind of organize thinking about how complete streets move from that policy to that systems level piece. And so we think about it on the left side of what you're looking at and what we consider the processes. So we're thinking about a city or town and who is touching the various elements and making decisions around roadway infrastructure, capital improvements, things that are really going to result in complete streets and the environment that we're looking for. But then on the right side where the arrows are, we're also thinking about what are some of the practices that are being used, what are the rules, what are the regulations, what are those pieces that people can look at and look for to actually find a home for this. So again, as decisions are being made and as people are looking for references, those things are being touched to think about, again, what results in complete streets. And then to provide a little bit more of an example of it, if we focus on the right, on those practices pieces, one of the things we think that's important to go about doing that and to think about pulling that fan apart and thinking about the pieces is actually looking at the language that exists within these regulations. So you have that policy as a foundation that makes that commitment to say we're going to look to build a system that has this. And so what we can do is we can go into various elements. In this particular case, we're actually looking at site plan regulations and thinking about how they can result in complete streets. So these are the standards, for example, that might be followed as you're thinking about a new commercial development, as you're building new stores or a new shopping center, as you're fixing up your downtown and you might want to put in some new development. Often, many cities and towns will have site plan regulations, and thinking about how we can actually get into those elements and think about what decisions are being made and what's being considered. Is there a way where someone can actually be putting off a sidewalk very easily and kind of not have to do it? Or is it something where it becomes the default that sidewalk must be part of it, that must provide the opportunity for pedestrian mobility, again, and then getting back to that as leading to the default choice of walking. So again, coming back to this, again, thinking about where we're touching on all those sides. And the one thing I would actually say on the practice side, I think that's really important when we think about systems at this level, is whether or not those pieces can be influenced. So for example, there are certain regulations that do require a legislative change. So you may have to go to a particular place or you have to talk to a city council or board of selectmen and go to a higher level to get that vote, to get that change. But there's also rules and regulations that sit within there that are actually within the control of a particular committee or board. They set it themselves, and it's set at that meeting. And sometimes they can provide a very good target for kind of easy early changes and early wins. Now to switch to the other side, to that process piece. And so thinking about who are the various bodies, decision makers that are involved in the systems as well too. Because again, even the best regulations, even the best rules that we have still need to be interpreted and then ultimately implemented by decision makers, potentially even staff, and those people that are on the ground doing the work. So thinking about them too as a systems piece. And so one of the things that we've used and sometimes we'll think about is what are the various roles that they play within that particular municipality. So for us thinking about whether or not the city or town, who's playing an executive function, who has the role in kind of passing and adopting legislation, and who has roles in some of these other elements, even if they're tangential. So even issues maybe potentially related to wetlands issues and whether or not what's happening with that particular roadway in an area that might be a sensitive habitat. So thinking about all those various elements. And I will comment here that it is, again, a complex consideration, but it is something that if we think through each of those pieces, I think that idea, like the seatbelt idea, becomes something that gets implemented much more easy. And ultimately, I just want to keep everyone aware that as you can get caught up in those systems pieces, we do have kind of a good focus in mind. It's ultimately that environmental change. And specifically in the case when we're thinking about complete streets, we can make all the changes in the world, but if it isn't getting constructed, it's not making changes and it's not making those choices easier and providing easier, healthier options for those people in that area, residents, others, visitors. So I'm going to switch it up a little bit to a different perspective now, to a second example. So often, again, too, as I just mentioned, so you have these government regulations and you have other regulations that may set up how development occurs, in particular there, the transportation system. But often on the private side, there's also decisions that are being made regarding development itself and how those decisions are being made. So often someone's looking for their development to be financed and how you're going to fund that. There's certain requirements that that funder has to kind of think about that. And ultimately, it's going to have those outcomes, both financial, social, but also potentially health impacts and health outcomes that are coming to it. And so we had the opportunity, we were fortunate enough to work with some individuals who are creating a fund called the Healthy Neighborhood Equity Fund. And the idea with that was whether or not we could actually think about how a financing mechanism could impact the development that's occurring in a particular place. So I offer this and start here because this may be different than a particular example that we think of, because often we may be thinking of something that's a public set regulation. But on the private sector, there's also policies that impact what we actually see and what is going to go into that. And so what we had the opportunity here was actually think if there was a policy being that we're going to use a development fund not only to think about a financial return, not only think about economic impacts, but we're also thinking about the health impacts and the ability for that fund to transform a particular area. So in this particular case, what we looked at were called transit-oriented development, when you essentially kind of focus commercial and residential development around a place that's served well by transit. And to think about how we could set up the systems piece of that fund, so it would be looking to fund and support projects that look to get a return on health, but also to use it as an opportunity to influence those projects themselves when health is being considered. And so what you see kind of in the background there is what we use would be a pathway diagram to think about if we have this new transit-oriented development, what are some of the changes that we could imagine to occur from that development? In this particular case, we thought about housing, transportation, traffic options, but we also took it to the level of thinking about how it could even transfer things in the social realm as well. Coming back to the physical part of it, thinking about the fund, and again, as someone's coming in for a development, not only looking at that particular development of whether or not they're going to get that financial return, but will it have a transformational impact on that area? So for example, what if you have a development being proposed in an area that you look at as very poor access for health foods? What could you do with that particular element? Could you actually talk to that developer, and could you actually make the case to them that when you have that development occurring, that there's actually this greater need in the area for food access? And would you be able to say, incumbent upon us helping you finance this deal, we'd actually like you to think about providing some space, potentially maybe for a farmer's market or somewhere you can actually house, somewhere where you can provide healthy, affordable foods. And it doesn't only exist in that regard. It can also exist in the regard of thinking about, as that development comes in, do you have a well-established neighborhood, and could you actually be affecting issues related to displacement, connecting those social health issues? Could that development be coming into a place where there may actually be issues with crime or violence? Thinking about the impact that that development may have to actually make places more safe so people can be physically active, even if it is a place with sidewalks and bike lanes. And then also if they're thinking about when that particular product is coming in there, what's the programming in terms of jobs? How does it match those residents that are there now, whether or not it's going to provide them with economic opportunity? And just on this particular point, I can actually offer kind of one example that I know anecdotally, is that there was a housing development, a low-income housing development that was being proposed through this fund. And having gone through this process and screening for these certain factors, so again, having that policy approach and then thinking about the systems, the indicators related to health, they were able to ask that developer to actually shift what was being proposed so that heating, ventilation, and air conditioning equipment no longer face an affordable housing project, but actually was put in a place where essentially in terms of sound and noise impacts, it wouldn't actually impact them the same way. So using that influence at the policy level and then ultimately expressing the systems piece to then have an environmental change on the ground as that development occurs. And so lastly, I'll touch on something that's I think a little bit more aspirational at the moment, although I know Kathleen will talk more about the smoke-free housing piece. But we know housing is really, really critical piece in terms of long-term health outcomes and having people have a stable health, whether or not they be in a family situation or an individual situation. And we know that's related to housing availability, having access to that housing, the affordability of that housing, as well as once you get in that housing, are you able to stay stably housed in that particular way? And so working with Health Resources in Action, we had the opportunity to actually look at how issues related to community development and health interact. And what you'll see is another version of a pathway diagram here, but this was a way for us to think about how can we communicate and bridge what's going to happen at kind of a broader level at that base of the pyramid with changes that occur in the health realm. And so what you'll see at the bottom in there within the yellow box is actually highlighting some of the work that community development corporations do related to affordable housing development. They're creating more units, they're creating more units on the ground. But if you follow that circle going into the inside, you can actually see it's also leading to other changes, some directly, some indirectly, again, some more distantly, but the idea that it's actually changing a particular area and housing is having a fundamental impact on the long-term health outcomes of that area. And so what we've done, having that framework in mind, it gives us a communications piece where we're thinking about identifying policy and environmental changes, but we start from that place and we can use that. But it's also then led us to think about, when we think about the policy level, is there state legislation that's potential to speak to housing production? We know in some cases affordable housing is a very large issue, and a lot of that's actually related to how much housing you can produce and the type of housing you can produce in that particular area. So thinking about that, is that a way to get at the policy level if this is an issue that we've identified? Can we look at residential zoning changes? So thinking again back to that municipal level, can we actually get at the residential zoning that's setting up what can be built and where it can be built? And then I think, again, to reference what Kathleen will talk about, is just thinking about some of the things you can do about what's going to happen in the interior and around those buildings. And then lastly, can we use those mechanisms to really generate some environmental changes? So does it actually create more housing units? Can we also think about the variety that's used? So for example, families might need more bedrooms than a one-bedroom unit, and thinking about where that's available. And the same thing with affordable units, so whether or not we're actually creating units that are affordable to people in a variety of cities and towns, and not just being concentrated in certain locations. So I'm just going to come back and just end in terms of, that's really based on my experience in doing this work and how I approach this work. And hopefully you can think about how this parallels some of your work, and also that framework of where you're going to find that root cause of the policy, where you're going to find how that policy can be pulled apart and the systems changed a bit, and then ultimately what happens environmentally on the ground and what we see in our physical place. And I'm just going to end on this one image on the back as well too, which is sometimes a tool that we've used, which is kind of a root cause diagram or the root of health diagram that we use. But it's a way of actually working people back from up in the trees, thinking about what are some of the health issues that people are dealing with. In the red, you'll see actually what are some of the behaviors that are driving those health. And then ultimately at the base of that tree, what are some of those broader societal issues that are creating those behaviors and potentially leading to those health outcomes. And this has been a way for us as well to kind of use and think about how you can get to that idea of policies, how you can get to the idea of systems and environmental changes, getting really to the root of those issues and seeing what it's resulting in. So I'll stop there. Look forward to any questions you may have at the end of the program, and I'll turn it back to Aaliyah.
Thank you, Barry. That was really, really informative, and really, I love your slides. They're really captivating, not only just in how they look, but even just in the content of what you shared. I think it was very practical and useful for folks. So thank you for that. I wanted to have everyone, I know we've sort of been sitting here for a minute, so I'd like to give everyone just an opportunity from wherever you are, if you're sitting at a desk, we'd like to, if you want to take this time just to do a quick stretch, keep the blood flowing, stay awake. You know, it's after lunch for most of us who are on the East Coast. So if folks just want to take a moment to do that as we get ready to transition to our presenters from Springfield. So while I am introducing them, you all can take a moment to stretch. And we are actually going to stretch ourselves too here. So all the presenters are also taking a stretch. So without further ado, I'm going to introduce Nicole Borden and Karen Pullman. Nicole Borden is from Springfield Mass in Motion, where she is the program coordinator of this initiative. And this initiative is a program of the Massachusetts Department of Public Health. It's a statewide initiative that promotes opportunities for healthy eating and active living through policy, systems, and environmental changes. Nicole oversees the initiatives that focus on school food, safe open spaces, healthy corner stores, safe routes to schools. She's also the chair of the Springfield Food Policy Council's School Nutrition Subcommittee and a board member of the Mason Square Task Force. She is going to be accompanied by Karen Pullman, who is the manager of community programs at Baystate Health. Karen is an award-winning and highly skilled system program manager with a special interest in altruistic health. Karen has participated on diverse global health teams that have created and supported capacity building infrastructure for healthy communities. And I'm really excited to have her to be able to participate and share her perspective in this example. So without further ado, I'm going to turn it over to Karen and Nicole.
Thank you, Leah. Well, we're here today to talk about our walking programs and how they've impacted safety and how we've been able to create policy and systems and environmental change. Just trying to change the slide. Thank you. So I just wanted to give some quick background on Springfield. We're the second largest school district in New England, and our graduation rates are well below the state average at 56%. Currently 10 of our schools are level 4 schools. Many of our schools don't have PTOs, so we have very low level of parent involvement. We have twice the national violent crime rate here in the city. And 4 years ago, Springfield was ranked one of the top 20 most violent cities in the country. And we're a main hub of the drug pipeline that comes up from New York to Vermont and points north. 42% of our public school students are overweight or obese, and 30% of our city's population is below the poverty level. Next slide, please. Next. Great. So our main partners for initiating a walking school bus program were the C3 Policing Initiative, Mass in Motion, and Baystate. The C3 Policing Initiative is an innovative safety program led by the Massachusetts State Police and Springfield Police. Understanding the missions of different organizations was really critical, and the mission statement for the C3 Policing is to facilitate unity of effort and criminal intelligence gathering by, with, and through interagency community and private enterprise cooperation in order to detect, disrupt, degrade, and dismantle criminal activity. Mass in Motion is a statewide movement that promotes opportunities for healthy eating and active living in the places people live, learn, work, and play. Baystate Health's mission is to improve the health of the people in our communities every day with quality and compassion. So sometimes when you're working with multiple sectors of the community, you need to modify terminology to align goals. But ultimately, all of us bought into safety, community engagement, exercise, school attendance, and environment. Next slide, please. So the Walking School Bus Program speaks to multiple different spokes that address public health safety issues such as community safety, exercise, increased school attendance, and community engagement. Next slide. This community integration framework is a good tool for reference. I developed this framework to organize the four main building blocks that the many sectors that could support this program. You know, it was a way just to organize and move forward over the last couple of years. Starting in health, I worked clockwise around the circle year to year, adding different stakeholders to increase momentum and support of the initial program. Now, by working closely with different sectors, such as Mass in Motion, it became clear that when I moved around this circle, they were able to lend a different perspective to this framework and move towards inviting different partners that maybe I never had even originally identified.
Yeah, and obviously Safe Routes to School is a natural initial partner, and then partnering with the school departments, DPW and city planning, and you sort of use this as an asset map to identify who all your partners are. And as you grow and expand, you realize who's not at the table. When we were first starting out, we quickly discovered, actually not quickly, but soon after discovered that there was a transportation coordinator for the Springfield Public Schools, and he really helped us figure out which schools are really poised to start walking programs. And as we grow and more partners are brought in, we partnered with the local colleges who really were able to provide a crucial role in helping staff the walking school bus. And as you grow and create clear work plans and get your name out there and go to meetings, you just eventually pull in all the partners you need. And to the left of this diagram, you see our task force, which supports the work.
Next slide, please. After the original program success, we wanted to continue the momentum, so we developed different program formats to evolve with the various community needs. One of the formats was the Brookings School and the 100 Mile Club. This program utilized a before-school model led by the physical education teacher, and there was an informal walking program to the school, and then there was a formalized process on the school grounds. Another program format was a partnership with a local university and generating a community component for their students in which they were leaders of a walking school bus program. Next slide, please.
So after having some really good initial success with a walking school bus in the north end of Springfield, we, in 2012, were able to work to get our first policy change, which was getting the walking school bus and walking programs mentioned in our district school wellness policies. And this came about, for those in Massachusetts may remember, an act signed in 2010 required all Massachusetts schools to rewrite their district policies in regards to competitive foods. And so we used this opportunity to rewrite our full policy, and we included this segment on schools encouraging exercise and walking programs before and after school. And so with this in the change of the policy, school nurses, principal staff were all trained on these policies. And so it really helped us raise awareness and provided us with a good launching point to expand the program when this came into effect in 2012.
Next slide, please.
And then our second move toward policy, in 2013, we had 3 successful walking school buses up and running in the city. And a city councilor who's been a member of Mass in Motion from the beginning and a real public health champion offered to help us with a proclamation at City Hall just to raise awareness of the walking school bus and the success it's had in regards to violence prevention and attendance in the city. So the proclamation talked about the benefits of the walking school bus in engaging parents and children, reducing tardiness, alleviating our high obesity rates, and the benefits of the community in general. And it was another great opportunity to engage and raise awareness among city councilors. We're really interested in hearing about this. And then our next goal, Springfield's just created, sort of fresh off the press, a complete streets policy. And our regional planning council, in partnership with an organization of Springfield, recently published the Bike and Ped Complete Streets Plan, and are currently working with DPW to champion this before City Council, either as a resolution, probably as a resolution.
Next slide, please. So moving from policy to system change, our first pass was a state turnaround plan with one of the schools inside Springfield. The walking school bus was written into that plan as an attendance tool, and it was directed towards school level effectiveness and systems of support. From that aspect, we moved towards the DTA pilot, which is a Department of Transitional Assistance and Springfield Public School Volunteer Department collaborative. And what that does is allow community members to merge different elements of their time, whether it be volunteering through the schools or some other community aspects, along with leading walking school buses to fulfill their requirements.
And then next, we're working toward a regional plan that would align the work of multiple mass motion communities in western Massachusetts, Baystate Hospital, the Pioneer Valley Planning Commission, all who work to support safe routes to school initiatives. And the main component of the regional plan, one of the main components, is aligning healthy activity opportunities like safe routes to school and safe parks and joint agreements.
Next slide, please.
And for environmental change, we've had a lot of great support from Walk Boston. They've come out to Springfield, and actually next week we'll be conducting their 6th walk audit with our schools, and they've produced these great reports with really solid recommendations for city planning and DPW on how to make some infrastructure changes around schools to make them safer and more walkable. So we've had some of those changes made, and we feel we've really gotten DPW's ear on how to make our streets safer. And then last year we got our first bike lane in the city. We're working on capitalizing on repaving projects and getting more lanes and connecting the lanes to connecting the parks and to our river walk. But in terms of community safety and community engagement, Springfield has seen certain neighborhoods have seen a 50% reduction in crime in the last 2 or 3 years. We now have neighborhood street leaders. There's greater community participation in neighborhoods. There's positive community police relations. And the C3 initiative, which was initially just in the north end of Springfield that Karen referenced, is now being rolled out citywide. So there's more opportunity there to partner with the police to continue this into other neighborhoods.
Next slide, please. So here are our partners who have all had a role in sustaining our work. We'd like to highlight their partnership with us. And we will look forward to fielding any questions from you at the end of the overall webinar. Thank you. That completes our presentation.
Thank you, Karen and Nicole, for helping us understand some of the great work that you all have been involved in Springfield, not just with the schools, but really it sounds like, well, obviously from the slide, there are tons of partners that you all have been able to engage, which I know is key in really the success of this type of work. So thank you for sharing your example. So now we're going to actually, oh, here's our contact information. What we're going to do now is just shift to our final presenter for this webinar. This will be Kathleen McCabe from Health Resources in Action. She is the Director of Public Health Policy and Practice. She's been a part of this team since 2007 and brings both strategic leadership and technical content expertise to this work. During her time here, she has managed smoke-free housing work and led best practice policy research in areas of transportation, chronic disease, climate change, healthy homes, and is just, you know, just a wealth of experience and expertise. So I'm going to turn it over to Kathleen.
Hi, everybody. As Aaliyah mentioned, I've been working here at HRIA since about 2009 on promoting smoke-free housing policies across the state of Massachusetts and regionally here in Rhode Island and also in the state of Texas. I work in partnership with a colleague, Chris Banson, who works at the Public Health Advocacy Institute at Northeastern University's Law School. And together, the two of us provide technical assistance to housing and health organizations as they consider and implement smoke-free housing policies. In my presentation, I'm going to sort of put this issue of smoke-free housing into context and provide you all with a little background on the issue before I delve a little bit deeper into what a smoke-free housing policy looks like at the landlord level, and then pulling back a little bit, talking about some strategies for promoting and implementing smoke-free housing at a broader systems level. And I'm happy and available to speak with anyone about this issue either at the end of this presentation or offline if people have more sort of in-depth questions that they'd like me to answer. So why smoke-free housing? Really, quite simply, according to the U.S. Surgeon General, there is no safe level of exposure to secondhand smoke. It's a Class A carcinogen, meaning it causes cancer. And we're doing this work in multi-unit housing buildings where, by design, the buildings are built to maximize airflow. That is, you know, air quality in general is better when there's flow between units, and so that will really reduce the likelihood of moisture and mold in buildings. But unfortunately, if somebody is smoking in their unit, that means that it's impossible to contain the smoke in the unit. There's an organization called ASHRAE, which stands for the Association or the American Society of Heating, Refrigeration, and Air Conditioning Engineers. They really set the standards for air quality in buildings, and they've said that through ventilation or other sort of mechanical fixes, there's really little that you can do to prevent smoke incursion, and that the only way to effectively eliminate secondhand smoke exposure is to remove smoking from buildings. So that's sort of the background information about how I got started working on this issue. My work is funded through the Massachusetts Department of Public Health and some other funding sources, and in this state, in Massachusetts, our work really emerged out of the secondhand smoke-free workplace law, where we removed smoking from workplaces, including restaurants and bars. And at that point, there was a huge uptick in complaints to local health departments about secondhand smoke exposure in homes. And before that, we hadn't really thought about secondhand smoke exposure in homes. But we do know now that home is the place where children are most exposed to secondhand smoke, and it's a major source of exposure for adults, especially in places where they're protected in the workplace. I don't want to spend too much time on this, but just wanted some background information. Secondhand smoke is, like I mentioned before, causes cancer. Since 1964, 2.5 million non-smokers have died from diseases caused by exposure to secondhand smoke. New data from the U.S. Surgeon General shows an increased risk of stroke among non-smokers by up to 30% if they're regularly exposed to secondhand smoke. And we know that children, in particularly, as well as adults with compromised immune systems, are especially at risk for long-term health outcomes and short-term health effects. I want to talk briefly about what I mean by a smoke-free housing policy. When I'm talking about the policy, and I'll talk more at the end about systems change, but in terms of policy, what we mean is that a landlord would impose a rule that is part of a lease that a resident would sign. The rule would say that the resident and all of their guests, anyone in the building, are not allowed to smoke in the building. Sometimes those rules go beyond the building and apply to outdoor areas as well. And importantly, a no smoking rule means no smoking and not no smokers. So people who smoke maintain their housing when a smoke-free housing policy is implemented. They're just asked to go outside. In terms of the decision makers in the work that I've been doing, first talking sort of at the individual level around the landlords, the decision maker is the owner of the property. The approach is voluntary, meaning that there has, in Massachusetts anyway, until this point, not been any regulation saying that people have to adopt smoke-free housing policies. Practically, it means that my colleagues and I across the state provide education and tools and information to landlords, management companies, and others about the health benefits, the fire safety benefits, the cost savings associated with going smoke-free, and work with landlords through an effective process that really engages residents over the course of 6 months to a year to adopt a change in the lease that would then prohibit smoking in the buildings. That said, since this isn't a regulation, landlords can take our information and our tools and adopt and implement policies as they wish, since it's a voluntary decision. The reason that we've used this approach until this point is because we feel like buy-in from the decision makers, landlords, and management companies in this case, as well as those who live in the property, is really essential for the long-term compliance and enforcement with the policy after implementation. There are some municipalities in other parts of the country that have approached this issue of smoke-free housing policy implementation differently and have regulated about it. There are some examples of some cities and towns in California in particular that have enacted legislation that requires landlords to be smoke-free. In Maine and Oregon, and additionally to Amherst here in Massachusetts, they have local or state laws that require landlords to disclose to prospective tenants whether smoking is allowed or not. So there are some other approaches sort of beyond this voluntary approach to policy change that we're doing here in Massachusetts. Just wanted to give folks a brief overview of sort of the process. Like I said, this process can take between, sort of at a minimum around 6 months to a year. We have tools embedded for the steps of the process that are outlined here in this slide, and there is a toolkit that will be available on the Massachusetts Department of Public Health website within the next couple of weeks that have tools for each of these steps that are outlined here. Just wanted folks to have a sense of how we're engaging residents, landlords, maintenance staff, home health aides, health centers, and all sorts of types of partners throughout the process. There are a whole host of policy decisions that go into adopting a smoke-free housing policy. I'm not going to spend too much time on these because I think the purpose of this is to sort of help understand the various types of approaches to smoke-free housing policy. So like I said before, if people are interested in understanding more of the components and the various approaches that landlords across Massachusetts are taking on these issues, I'm happy to delve in. But a broad overview, some landlords grandfather current residents, and that's becoming less and less common. There are sort of various approaches from property to property about whether landlords will designate a smoking area or not on the property, do it in some of their buildings or across all of their buildings, and there are also some various approaches to sort of interesting issues around e-cigarettes and medical marijuana, which I could also talk with people offline about. Where I want to spend the bulk of my time is to talk about sort of the difference in policy change versus sort of a programmatic implementation of these policies. So traditionally in public health, we would have encouraged people to quit smoking or to go outside by doing some education, passing out flyers in buildings, working with landlords to bring a smoking cessation group to residents, or otherwise educating residents about the negative impact of smoking or exposure to secondhand smoke. And these efforts are all worthwhile, and to be totally honest, a lot of them are integrated into the policy approach, and so we don't separate them out. The education component is a key part of adopting a policy. But without a policy, there are no legs for enforcement. There's no way for a landlord to guarantee or to get to a place where the air is actually cleaner unless there's some sort of mechanism for them to implement and enforce the rule. And so the lease addendum does just that at the individual landlord level. So it's an agreement between the resident and the landlord to be smoke-free. So while the intention is not for people to lose their housing over this, just like with any other violation of a lease, there is the potential, there is that course of action that a landlord could take if there was a continual violation of the rule. So until this point in the presentation, I've been talking a lot about how landlords can implement a policy and choose to do so voluntarily. I'd like to connect the work that I'm doing a little bit to the framework that Barry referenced, which was really useful 2 presentations ago, to talk about promoting smoke-free housing at a municipal level or at a sort of a broader systems level. And I can talk about some examples of what I've been working on and where I could see some potential for change at the local level. We have been working for a couple of years now to promote smoke-free housing policies in partnership with some of the largest, sort of most influential housers in the state. And so a lot of housing, especially low-income housing, financing comes through the Massachusetts Department of Housing and Community Development, which is called DHCD, or also federally through the United States Department of Housing and Urban Development, HUD. Within the last few years, both HUD and DHCD have strongly encouraged landlords that receive funding from them to adopt smoke-free housing policies. So it wasn't until those sort of big agencies committed to this issue by saying that we really strongly encourage you to do this. They developed their own guidance, which they issued through toolkits and other ways of communication to all of the landlords, that we really saw a huge uptick in folks adopting smoke-free housing policies. Here in this state, we're also working with the Massachusetts, with Mass Housing, which is another really large financing agency of affordable housing here in Massachusetts, and offer trainings to all of their landlords regionally on this issue, sort of helping them through the process, which also has been encouraging them to, and hopefully the long-term goal would be that then Mass Housing would similarly encourage or require landlords who took funding from them to adopt a smoke-free housing policy. We've worked with a lot of large management companies and private owners of affordable and market rate housing to adopt smoke-free housing policies across their portfolio. And so instead of sort of going building by building or cluster by cluster, we're really tackling sort of the bigger fish to make an impact of get the bigger bang for our buck, as Aaliyah was talking about in the pyramid, hitting the most people at once. In terms of thinking about other levers, especially at the municipal level, I think Barry framed this in a really great way. Where are the sort of levers for influence at the municipal level? And I think one is through financing. There have been some cities and towns in Massachusetts that have explored giving developers extra points on a application process or an approval process as they're looking for approval on development, new development, or redevelopment. So if you have to go to approval at the municipal level for some agency, then that agency could put in its requirements for the developer to require their landlord to go smoke-free, or the owner to build a new development smoke-free. And that's been modeled here in Massachusetts and other places, and I think it's a really good place for cities and towns to be looking. We're also doing a lot of encouragement of the compliance of smoke-free housing policies by doing outreach to housing court officials, judges and clerk magistrates, mediators, so that after policies are implemented, there is better enforcement and compliance with the issues on that. And we're also doing a lot of support outreach to residents that are sort of at risk for losing housing by working closely with legal aid organizations and others to mediate issues that arise rather than going through an eviction process immediately. So while nobody is currently regulating on the issue of smoke-free housing in Massachusetts, I think that we will eventually probably get to that point when there's sort of a saturation where we hit the place where more places have smoke-free housing than don't, and it becomes sort of an equity issue where there are a few number of people living in buildings that still allow smoking, and those places are probably even more highly toxic than they were before because there's a higher concentration of people smoking in those buildings. And at that point, I could see that there'd be some regulation around this issue. Until we get to that point, I think there are other creative ways that we can think about promoting and encouraging landlords to adopt these policies at their own, on their own, or with the sort of prodding of municipal government. The impact of smoke-free housing policies is pretty big and important. In terms of a health impact, we're reducing secondhand smoke exposure, so we're improving air quality. We know that that has some associated health outcome changes. Smoke-free housing policies also reduce smoking. They prevent and reduce the occurrence of cigarette-started fires, which are the leading cause of residential fire deaths. They sort of continue to change the social norms around smoking, which has been happening over the last 20 years at least. From a financial perspective, we know that there's a lot of evidence showing lower operating costs among landlords, which are incentives for them to go smoke-free beyond the health and safety arguments. And there's also some interesting evidence that show that buildings that go smoke-free may also see some increased physical activity among residents who are getting out of the house more than they previously had been. Just wanted to close my presentation by showing, and this is actually, this slide is a little bit outdated at this point. Oops. Sorry. The work that I'm doing is across the market spectrum, but we have been able to more closely track what's happening in public housing than we have been in the private housing market. One, just because there's one person that we can call at a housing authority and get a straight answer on whether or not their buildings are smoke-free. But two, because it's happening very, very quickly across the market spectrum, we can't keep up with how many players there are sort of in the private market sector. We are trying to track that. But back in 2009, when I started to promote smoke-free housing policies here in Massachusetts, there were no public housing authorities with a smoke-free housing rule. By the end of 2015, we expect to see at least 80. This slide says 70. I think that number is a little low at this point, at least 80 out of a total of 201 or 241 municipal housing authorities in the state. And like I said, we're seeing similar trends across the market. We're really doing a lot of work to promote these policies in subsidized housing because, as you can imagine, private landlords and people who can afford to move more readily, those buildings are going smoke-free actually even faster. And so we want to keep the lower end of the market at pace with the upper end of the market. So that concludes my presentation, and I'll turn it back to Aaliyah.
Great, thank you so much, Kathleen. I always get amazed just hearing you speak about smoke-free housing and really just all the accomplishments that have been made in a relatively short amount of time. So I just want to take this time to thank all of our presenters. Thank you to Barry, Nicole, and Karen, and Kathleen for really just being able to share your own perspective, the work that you all are doing in terms of policy and systems change. So thank you for that. I'd like to open it now up for questions. So if folks haven't had the opportunity to get your questions in, feel free to do so through the chat function. We will continue to monitor that throughout this question and answer period. Just to get us started, I was hoping that each of our presenters can chime in on this, but really a question about engaging partners at different levels in your example. And so I know that each of you sort of mentioned different partners and different folks that you might have to have conversations with, that you might want to pull into this work, but I was wondering if you all could talk about how you actually engage those partners and get them excited about, especially the specific policy or systems or environmental change that you highlighted in your presentation. So whoever would like to go first to be able to answer that question can feel free.
Sure, I can go. So this is Kathleen again. In terms of partners, we have created some recommendations around who at the landlord policy implementation level we would encourage folks to reach out to. I mentioned some of those, but we really encourage participation from residents, whether it's through a resident task force or just reaching out in general to residents. Other partners that landlords have worked with are local cessation groups, inviting people to come out and talk about helping people quit if they're interested in quitting. Fire departments have been integral to coming out and talking about fire safety in terms of smoking and why it's important to get it out of the building. Community health centers have been great partners. And so at the really local level, there I think are some interesting partners that landlords can reach out to, in addition to their locally funded Massachusetts Tobacco Cessation and Prevention Program through DPH. There are local tobacco resources that folks can reach out to. In terms of partners at the systems level, I mentioned some of them, but my colleague Chris and I have been working with the court system. We've been working with the Department of Housing and Community Development, Mass Housing, and other influential city agency type folks that can help think through what systems changes and where those levers of opportunity are to really encourage the voluntary adoption of smoke-free housing policies.
This is Barry, and so I just add on that I think, again, so my background is planning, but I work in the field of public health, and so I have a lot of appreciation for how you bridge from one topic to another topic. And so I think having tools to do that, such as the tree that I pointed out earlier, but I also know that more recently Robert Wood Johnson's put out some really good materials in terms of how to communicate about health and use that terminology, keeping in mind that health starts in our neighborhood, starts where we live and work. I also think in particular the recent things that look at kind of zip codes and life expectancy, if you ever see that. I think those are really important tools, and I think it's just a great question to ask too, because I think maybe like other work, but to a certain degree, the amount of partners that are required, and the Springfield slide really highlighted that, is that it's quite enormous because there's so many pieces that you're looking to take on. But in doing it that way and building a collaborative approach in a way that can be communicated across a variety of different topic areas is really important. So it's out there.
So the community integration framework that we developed here in Springfield is really kind of a grassroots integration. And really what it speaks to is understanding what drives the different sectors and the different partners that you're wishing to collaborate with. And so when you understand what drives them or their organization, it's understanding that and then offering up a solution that is not an add-on to them. You're offering up a solution that's an add-in to what they're currently doing. So it's kind of selling a pitch of something that you've come up with that you just want their support, and you're not asking for money and you're not asking for anything other than word of mouth type of support, or if they had some sort of expertise that was really easy to learn. And that's really the foundation for how this framework became such a great collaboration, because it really wasn't asking for anything other than that.
And this is Nicole. I just wanted to add kind of a specific example, but you know, it's one thing when you're looking at, for us, working on environmental change and trying to get changes made with infrastructure around schools to hand planning or DPW a list of recommendations, and it's an entirely other thing to experience a walk audit together with principals and parents and police and DPW and community members, and all share this experience of looking at, you know, cars going too quickly, at infrastructure, crosswalks not being there. And so we've found that once we're able to get all of those people together, really has a much better chance of affecting change.
Thank you. I think it's incredible for us to be able to really understand at the different levels where Kathleen was talking about, you know, engaging with those partners that might be more at the municipal level versus the Springfield. I'm talking about other organizations and, you know, even involving sort of residents with walk audits to really get folks excited about this type of change. I wonder if Karen and Nicole, if you might even dive a little bit deeper in terms of, you touched on it already, but how do you really motivate or get the community motivated to participate in this type of work? I think it's great for, you know, when folks get out there and they're participating in something like a walk audit, but how do you actually even get them to come in the first place? And how did you overcome that? And what sort of tips might you have for some folks who are on the webinar?
Well, this is Karen. The walk audit was fairly easy because Nicole identified early on Walk Boston as a partner to this initiative, so I'll let her speak to that.
I mean, they're just, for any of those people out there and use them, I mean, they really help you identify some of the partners, and they're really engaging. They have a very compelling presentation they do before an audit that really gets at everybody's attention. But I think, you know, for us in rolling out the Walking School Bus program, a lot of it has spread through word of mouth amongst principals. Karen goes to schools and gives presentations to all the principals, and they find a way that, oh, it's going to help improve our attendance, or we're going to help alleviate congestion around schools at drop-off time. There's always a different reason why schools want to participate. So luckily, because we've had some success and some reached some benchmarks with attendance and those kinds of things, it's been able to spread, you know, more easily on its own.
Thank you. We've had another question come in. Someone was wondering very specifically, this is probably for the Springfield folks, but I'm sure, Barry, you might have some ideas as well. Someone was wondering if anyone had any experience with healthy market policy and systems change, and sort of what sort of tips or advice that you all might have around engaging with either the owners or the community to really be able to develop healthy markets, whether it's a corner store or a larger grocer.
You know, that's a tricky one, and I think those of us working in that field understand that. We are working, we have not been able to affect policy that way. We have done some food access policy work around vending machine policy, but for corner stores, we have not yet, and we're trying to figure out what that would even look like, and what, you know, we have hundreds of corner stores here, and they're all sourcing from different ways, and they all have a different capacity and provide different needs in the community. So it's hard to do something broad that is going to have an effect on all of them that's not that's positive for the community and not too damaging to the store owner. But we're working on a kind of a regional plan, looking at distribution, and we're partnering with some of the other mass motion communities out here, trying to positively affect some distribution problems out here. So that's sort of where we're at with corner stores right now.
So I would echo what Nicole said in terms of distribution being a kind of a key issue. I think, again, and I'm sorry if I'm repeating things people already know, but there is work coming down the pike related to healthy food financing, so an initiative at the state level to actually affect policy in terms of financing so that it's a more affordable option. I think if you have mass emotion coordinators nearby, or I definitely speak with them, because that's a population that's a group that essentially on the ground knows the populace very well, especially if they're working on a healthy food retail initiative. The other thing too, again, and hopefully I'm not repeating stuff that people know, but the city of Philadelphia has a very, very successful program and some really great templates and approaches. So I'd also point that out as another example for what people go to. And then the last thing I would add too is that I think, given some understanding of maybe potentially the ethnic or cultural background of those store owners, partnering with community-based organizations that understand and work with that population potentially more closely can actually help identify some barriers that we may not see immediately. We may see it as something as shelf space or something else, but sometimes it may actually be an understanding of the types of fruits and vegetables that might be wanted in that area versus maybe something that might be more traditional. And so I think in that case it's actually important to build those partnerships and kind of build on that community approach.
Mm-hmm. Thank you. Talking about back to partners, thinking about financial partners, we have a question here from someone that says, thinking about financial partners, do you think that corporations could or should play a larger role in driving policy and systems changes?
So I mean, I think that they should and they can. I think we're actually seeing a greater level of interest in terms of both kind of interest in workforce productivity and how that relates to people's physical and mental health. And so I think there is opportunities there. I also think, and sometimes I know I underrate this, but many kind of larger corporations do have foundations. So if you're looking for resources to support your work, connecting with employees at those companies to actually kind of help support that work, because the corporation as a whole may not see it, but that person who lives in the neighborhood that you're working in may be a good advocate for you and be able to connect you with those resources. And then I think as we think to motivate stakeholders in our particular area for changes, so if you are going to city council, finding partnerships with a potential chamber of commerce or someone else to be an advocate for you as well too, because they can't point now and say that the private sector isn't at the table, but they can be a partner for you as well.
Mm-hmm. Do any of our other presenters have any thoughts on that? Then we also have another question for folks in Springfield again. With the Safe Routes to School program, was that headed by a specific coordinator versus just Nicole, for you as the Mass and Motion coordinator? Was there a specific Safe Routes to School coordinator to help coordinate and manage that process?
So this is actually Karen. So interestingly enough, I started the walking school bus program before I even realized that it fit into the Safe Routes to School framework. And so the first initial pilot began without that partnership. And then as I reached out to Mass in Motion and found out about resources and became a partner through Safe Routes to School, I started understanding that whole system. And then what happened was we definitely had capacity and training support from Safe Routes to School. But what we did out here in Western Mass was, because we already had this momentum and we had this good partnership going, was we became kind of an alliance out here, a coalition for safe routes to school, and we were the driving force out here. And then when we needed help and reinforcement, we reach out to Boston and the Western Mass coordinator, and they would come give us support. But we developed our own alliance called Springfield Safe Routes to School Alliance, and I was the driving force of that here for our coalition.
Great. So Karen, just as a follow-up to that, what sort of was the impetus for you starting this up? Because I think it's important for folks on the webinar to really understand just some of the different drivers that sort of bring these things up. It can be sometimes funding, it can be something that's happened in a community that you're able to sort of bring the community together on. What sort of helped you get started?
So I'm part of a health system. I'm based out of a hospital. I'm based through a trauma center here in Western Mass. And so health was really a focus of mine, and I was given a directive to look at overall community health and impacting population health. And so through my background as a nurse practitioner, you know, it was understanding the health priorities of of the patient population out here in Western Mass and trying to figure out how to impact that in a meaningful way that started small and had the potential to grow large, but also move in a way that was meaningful for the community, something that they would like to be part of. And so having that kind of in the back of my head, and then going to this C3 pilot meeting, I guess, and their initiative was community safety. So kind of linking a lot of these different things, and they charged me with impacting the community as well. So I just linked a lot of those things and came up with a walking school bus program, which spoke to the community. It spoke to the kids. They liked having fun. It increased exercise. It spoke to patient safety or community safety by increasing numbers in kind of a very violent neighborhood originally, which it's not so much now. And just through gang violence, let me clarify that there was some spotty gang violence that really was an issue at the time when this originated, and everybody was really concerned about safety of their kids being outside and that type of activity. And so that was kind of the original basis for this. And you know, health priorities in general are kind of always moving, and so you have to always readjust and understand what is a priority of your community, and then make sure what you're doing is meaningful for them as well. So that was the foundation of this.
Thank you. Thank you. Yeah, thank you for sharing that. That's super helpful. I have one clarification to a question that was asked earlier about, you know, when I asked about the Safe Routes to School coordinator. Just to clarify with that question, is your program funded independently, or is it a part of Mass in Motion, is the question.
Well, you know, certainly through Mass in Motion, it's always for 5 years now been one of our objectives. But so it's really, you know, some of my time goes towards this, and Karen uses her time towards this. But the good thing about Safe Routes to School and walking school buses is it really doesn't require a lot of funding. So it's only paying for staff time. We have been fortunate when we have needed some funding for some gear for students that needed weather gear. We had a Help New England helps and YMCA help with that. But otherwise, we really haven't needed funding.
Right, and then this is Karen. So I'm Baystate. I received no funding from Safe Routes to School. This is just kind of an alignment of mission. I'm Baystate, and
oh, I think we may have lost you there.
Where did it cut out?
You said that it was in alignment with your work,
Yeah,
and that you're not.
Exactly, that's it. So I'm, you know, I put a lot of time towards this, but I look at this from Baystate's lens as a health initiative, and I received no funding from Safe Routes to School.
Thank you. We are just about out of time, but I want to try to squeeze in one last question for folks. If you had just sort of one word or one phrase to be able to answer this question, how do you keep the momentum of this going?
This is Karen, and I would say collaboration with like partners, or actually not actually like partners, just collaboration.
Yeah, it's the same thing. It's just partnerships and celebrating successes.
I'd use more than one word. I would actually say celebrate your successes and build a constituency.
And I would add to those, which I agree with, and say think creatively and sort of beyond the scope of partners that you're usually working with, and really think creatively about sort of how to encourage collaboration and implementation of these type of changes.
Great. Thank you all so much. I really just want to thank all of our presenters for taking the time out to join us today for this webinar. As I said before, we will be sharing the recording and the slides, as well as their contact information if you need or want to follow up with any more specific questions for folks. I also want to let folks know that through the Community Health Training Institute, which is a partnership with the Department of Public Health here in Massachusetts and Health Resources in Action, that during March we will be doing trainings, in-person trainings in health equity. So if folks are able to join us in one of these regions, we would love to have you come and join us. These are full-day trainings, and you can find out more on our website. So again, thank you everyone for participating in today's webinar.
Sure. Say thank you to Aaliyah for really well run that. Thank you.
You're welcome. I hope everyone has a great day.
Thank you.